My talk is on fertility preservation in males, the Indian perspective. Fertility preservation is needed in the four population group: the patients who are undergoing cancer treatment with gonadotoxic drugs, and we have another group with benign disease undergoing gonadotoxic treatment, transgender patients who are saying female at birth, and women requesting boosted cryopreservation for cage-related fertility loss. This last group is now increasing these days, female requiring boosted cryopreservation. And when we look at the male undergoing cancer treatment, among the males, cancer of GI tract is the most common, followed by cancer of head and neck, then gonadal junction and trophoblastic cancers. The non-oncological conditions requiring fertility preservation is autoimmune disease and hematopoietic stem cell transplantation, hematological disease like sickle cell, thalassemia, rare genetic disorder like infertility. All these patients also require fertility preservation. When we are talking of cancer, the issue is infertility is the most difficult component of the disease and treatment, and the oncologists are generally focusing on the survival of the patient. They are not bothered about fertility. So it can be difficult to assess who is interested in future fertility. The ethical consideration of fertility preservation in India, when you look at that, we have a lot of challenges like religious and cultural beliefs, the lack of regulation and inadequate access to the care. And patient may not receive adequate information because there is lack of regulation. It can lead to unsafe and unethical practices, putting patient at risk. This is the problem we are facing in India. There is lack of regulation, there is lack of knowledge, and patient cannot access the care. The barriers to fertility preservation is desire to avoid delays in cancer treatment, concern about costs associated with fertility treatment, lack of insurance coverage, lack of adequate facilities, lack of awareness, and so on. These are all the barriers to the fertility preservation. We had a paper published by Dr. Nina, who is sitting here, the knowledge and attitude and intention toward fertility preservation in cancer patients among the healthcare worker. What is the attitude of the healthcare worker in India? If you look at it, more than 1/3 of the 750 healthcare workers contacted, they answered the questionnaire. And if you look at this, among the healthcare workers involved in the care of young cancer patients, only 50% reported they had referred the patient for fertility preservation. The most common reason for not referring the patient was the lack of knowledge about fertility preservation. So when the healthcare worker have 50% healthcare worker have a lack of the knowledge. So we have to create the awareness about it. The fertility preservation in Indian perspective, culturally Indians are different from their Western counterparts. We are not open about our illness and much less open about the ineffectual treatment. Equally, there is lack of awareness among the healthcare professionals, like it was mentioned in her paper, and we need to have multidisciplinary approach, Dr. Pankaj mentioned. We need to have good referral system, cost-effective treatment, insurance coverage, and follow-up facilities. The role of multidisciplinary approach, you need a good collaboration between oncologists, reproductive medicine, psychologists, nursing and allied health professionals, and legal experts. These are all needed for a multidisciplinary approach. A consultant, reproductive medicine consultant cannot alone do it. When you need a person for fertility preservation, you need all the input from this particular specialist. And the pre-treatment evaluation, the importance of informing cancer patients about the potential risk of the malignancy and treatment of fertility, as well as available fertility options. You have to inform them as per ASRM, as per recommendation, you should inform them. The cancer treatment and infertility in females or male, any female who is having cancer, she has 40 to 80% chance of losing fertility following chemotherapy or radiation. And in males, similarly in males, 30 to 75% of male cancer patients can become sterile after treatment. This as per guidelines, fertility preservation in patients with cancer. This is as per guidelines concerning males, that patients who have proven for fertility preservation, you can do a sperm cryopreservation. And other investigation procedure is the sperm testicular tissue cryopreservation. We are going to talk about it. What is the cancer? How cancer is inducing infertility? Primary pregnancy itself can be caused, the tumor and host cytokine release. If you do a surgery for cancer, you can cause interruption in the sperm release pathways. If you are given radiation, any amount of radiation, those even less than 1 grade, can cause you azoospermia. Chemotherapy, alkylating agent are the greatest impairment to male infertility. This is how the sperm is getting damaged by various treatment like chemotherapy, radiation, immunological. This is the effect on the sperm damage. The unique consideration males, there is a greater chemo and radiosensitivity of testes. There is no protective effect of younger age. Even if he is a young boy, it doesn't give any protective protection, and there is a negative effect on sexual function. The patient who receives chemotherapy or radiotherapy, the sexual function also deteriorates. The fertility preservation, now we come to prepubertal males, that is the childhood cancer. 80% of children and adolescents are diagnosed with cancer, they become the long-term survivor. They receive the treatment, they receive chemotherapy, radiotherapy, and this group is the long-term survivor among this cancer patient. And one of the long-term side effects of cancer therapy is premature congenital failure. So loss of fertility is an immense concern, and many cancer patients prefer to have biological children rather than to adopt using third-party reproduction. Cancer among adolescent and young adult is merit attention. While the incidence of cancer in young adult is lesser than that of older adult, the population pyramid in the developing countries is predominantly young. If you remember, most of the time our Prime Minister was talking that in India, 30% of the population